Hi again. Here we are at the end of the track of the day, and our topic this time is safe travel during the pandemic. Uh, Klaus Felsche will talk about generating meaning and trust, analytics on COVID-19 goPassport. So, Klaus served as a senior officer in the Australian Army before joining the Department of Immigration and Border Protection. In 2009, he founded the first advanced analytics team in immigration, and within a year, led the successful implementation of the border risk identification system. In 2020, he co-founded goPassport uh, and is working with a multidisciplinary team to enable safe travel during this COVID pandemic. So, yeah, Klaus, the virtual floor is yours.
You a brief look at goPassport and some of the challenges associated with using data to reduce the impacts of the current pandemic on international travel. Well, I'm not really at liberty to provide details of algorithms and data models we use, in any detail at least. I can give you a few insights and highlight some of our challenges. I also need to emphasize that some components of our system are still being built. While we have an in-production real-time rules and messaging engine using omni-channel communication, an itinerary management system for most of our web interfaces have been built, the mobile app is still in an alpha version, and there are still some refinement to do about the system integration. We have, however, built our risk analytics system, and that is the focus for me today. You can see a public component of that system on our website. It's freely available. Let me talk about our objectives. Number one, our first objective is to keep travelers safe. So we're focused very much on the traveler at the center of our product and our processes. We aim to use data to assist the traveler in planning a safe journey, staying safe while they're on their journey, and assisting the traveler when they may need this assistance. To do this, we require global data about up-to-date and emerging risks. And it's not just all about COVID-19. We also have the ability to predict risk. It's very useful in this particular setting because most of you know that when you plan a trip, it is in the future. It doesn't usually start today. So today's situation in the world, in the current environment, is not likely to be the same situation in a week or 2 weeks from now. So looking at the future is extremely useful. Opening up borders to travellers requires a high degree of confidence that inbound travellers pose no significant risk to the local community, particularly if the community has managed to control the pandemic within their own country. If this cannot be done, then all foreigners will be looked on with deep suspicion. Everybody knows that COVID-19 travels by air or sea, and its host is a human carrier, a tourist, a student, a visitor, a business traveler, and that means that if there is suspicion that that person will bring in the virus, the welcome will be very cool indeed. Currently, many countries tend to have binary and blunt instruments to contain the pandemic or to keep the infection out. Quarantine, first described over 600 years ago, is still considered best practice. Our neighbours here in New Zealand are a good example. Their borders are generally closed. Any people who arrive, which is basically residents and citizens of New Zealand returning home, are required to quarantine for 14 days. Other countries have effectively given up and are open to all. Some of those countries are experiencing severe stress as their health systems become overwhelmed. Some others have responded by locking down the whole country in response to being overwhelmed. Some countries rely on on-arrival COVID-19 testing, while some require a pre-departure test. As you will see later, these tests have limited utility as asymptomatic carriers may not be identified early in the infection cycle. Governments are facing some really tough decisions. Some governments have a choice. A country like Australia, for example, has a choice to open or to close. While the economic consequences of closing the country are quite severe, so we are suffering our first quarter of recession in over 30, or almost 30 years, some governments have little choice. They're facing economic disaster, and on the other side of the coin, there are high fatality rates. In all of this, is safe travel possible? What makes the 21st century different when managing pandemics? Can we use our ability to collect, analyze, and use data with fast communications to get beyond the binary open and closed approach or the blunt instruments used for hundreds of years? Can we guarantee that a traveller will be safe and that the community will not need to fear travellers? The answer is yes, of course we can. That's why I'm here. Medical technology has provided us with pretty good COVID tests. When applied correctly, these give us a high degree of confidence about a traveller's health. It's not perfect, but almost, particularly when used in combination with other processes, and particularly when it is administered appropriately. And I'll talk a little bit more about that a little later in the presentation. We have the technology to allow individualized pathways for travellers to be constructed based on the actual risk they may represent. For example, we need not apply the same process for every traveller because every traveller represents a different risk profile. And we now have the technology to manage travellers automatically based on the individual risk profile that they hold. So we no longer need to have a one-size-fits-all approach. So before we see more, here's a little about my background. I'm a graduate of several universities in Western Australia, New England, New South Wales, and other institutions. I spent some 26 years serving in the Australian Army before joining Australia's Immigration and Border Protection Department. Most of my time in this department was spent on ensuring that our border processes were state-of-the-art. In 2009, I established the department's first advanced analytics capability. If any of you have travelled to or from Australia since 2010, you've been risk assessed by real-time, high-performance, advanced analytic systems designed to identify risk. These systems resulted in an accurate identification of a range of risks in visa and border processing and enabled many travellers to access fast-track processing as they were identified as low risk. Our efforts went to looking at those travellers who were identified as high risk. All of these processes rely on our capacity to apply accurate, complex, real-time analytics. Our border risk identification system, in its first year, allowed over 270,000 travellers to be treated as low risk, saving nearly 1 million hours of inconvenience for those travellers and the relevant staff times in its very first year. You can imagine the financial savings, as well, of course, the gains in convenience. You can also probably see where I'm going with this. If we can do this for a range of risks, why not for COVID-19? Why can't we use similar approaches to identify travellers who are effectively safe and can be fast-tracked, and more importantly, can be allowed into the country? Time now for a break from me. Here's a short overview.
How can Australia restart our industry sectors that support international education, business, tourism, and migrant workers? How can we do this at scale with a high degree of risk management, control, and audit? Introducing goPassport, a patented real-time monitor, audit, and alert process providing visibility of visiting non-residents through a powerful combination of advanced analytics, itinerary monitoring, and rule-based robotics. Before a non-resident leaves their home, goPassport uses advanced analytics to prioritize the risk of their country of origin. A low-risk infection status allows the non-resident to review the risk profile of the available flights and aircraft type for safe passage to Australia. The traveller follows the guided policy compliance steps, including pre-travel COVID-19 testing, travel itinerary reporting, and risk reduction behaviour, to ensure they are eligible to board a plane. On arrival, goPassport monitors the traveller itinerary, ensuring compliance against the government's requirements such as quarantine by utilising real-time geofencing, biometric and location-based verified logins. During this time, goPassport monitors the non-resident's health, providing access to any support services required, such as mental health and telehealth, and making sure their status and progress is shared with their personal support network. Then, when travelling in Australia, goPassport monitors the itinerary pathway, tracks the visitor's self-declared health status, and generates alerts should the traveller trigger non-compliance. In the event of an illness or status change in their pathway, goPassport automates the next best action procedure, escalating rapid contact tracking policy and telehealth management, vastly reducing time to respond for containment of spread. The accumulation of trusted data profile and machine learning insights, policies, and programs can be adjusted to reflect true risk management and provide accurate data-enabled decisions.
Welcome back. Going back to my days in immigration and border protection, here are a couple of lessons that we've learned. We learned that any control by itself will have gaps, and that a good strategy is to have multiple layers of control to compensate for the limitations of one layer. We also learned that it is actually smart to mitigate most of the risks before people start their travel. In the COVID setting, of course, this is very popular with other travelers who are on the same flight, knowing that everybody on the flight is clear. It's also very comforting to the crew, knowing that the passengers on the flight are clear. And more importantly, of course, the traveller feels safe, and of course, the community that they're about to visit feels confident. Here is our model. Please note that not all layers are necessary for everybody. For example, our neighbours, the New Zealanders, travelling to Australia, only require symptom screening and flight risk assessment because the country is effectively COVID clear. Travellers from higher risk ports will be required to pass through more controls to ensure that they represent no risk. Let me describe a couple of the layers. First of all, country risk. We assess the current risk down to province, state level in most countries. We're using publicly available data, and we're using multiple data sources, as we found that a single data source tends to have unreliable features. So again, multiple sources will increase the reliability of our assessment. We look at a traveller's travel history. This is important as a person may well, over the last 2 weeks before travel, have visited locations that are higher risk than their home country. For example, a New Zealander who has been to the United States in recent days will be considered to be a much higher risk than a person travelling directly from Auckland to Sydney. Symptom checking. There are two sorts. There is the symptom checking carried out by professionals, symptoms checking carried out by professionals at border control points, and you've all seen some of the pictures of the temperature scanning. You may even have been subjected to that yourself. And then there is the self-symptom assessment. goPassport includes a self-assessment component, and yes, that the results of that are recorded and monitored. And if the symptoms indicate that the person may require assistance, goPassport will alert them to seek some further medical assistance. I'll discuss COVID testing a little bit more later. It's a very powerful tool when used correctly, not very useful when it's not used correctly. Once vaccines become available, we have the ability to record and assess the risk posed by travellers who have been vaccinated. We already know that, like influenza vaccines, They are not silver bullets. Their effectiveness is unknown and will be unknown for some time. And we don't know how long the immunity, if people have appropriate immunity, will actually persist. We assess airports, aircraft, and airlines. Airport policies that reduce risk of infection through proper management of people moving through the airport, airlines that have cleaning policies, and traveller management practices, for example, wearing of masks, seating arrangements on flights, how people board, how people depart, separating clear travellers from those who are not cleared, crew health procedures, luggage handling, and all of those issues are considered. Importantly, we look at the route taken. We consider the length of flights, traveller mix, for example, mixing low and high risk travellers on the same aircraft in a transit hub is not a particularly good idea. goPassport supports monitoring and self-isolation and quarantine compliance through its ability to monitor the location of travellers in those particular settings. This allows travellers to isolate at home or in supervised locations before departure, reducing any on-arrival quarantine period. In the end, we asked ourselves two fundamental questions. How likely is it that a person is infected? And how likely is it that a person visiting a location will become infected? None of this is easy, and getting it wrong either inconveniences the traveller or it puts the community at risk. And we can't afford any of those because trust is an important component in our system. As you can see, there are many sources of data. We use all of them and more that are shown here on this list. And some are more useful than others, but all have limitations. We try to compensate for the limitations by using multiple sources, and we constantly monitor the performance of those sources. As you would know, in analytics, 80% of the time is usually spent on wrangling the data. And from my observation, in this particular project, it's probably close to 90% of the time. We use 7 data quality dimensions, which are the internationally accepted standards for data quality. These are available through the UN, and in Australia, the Australian Bureau of Statistics maintains our framework, and we comply with that. All right, let's have a quick look at our systems. A lot of it is about location data. You can see from this view here that we do quite a granular view. The right-hand picture shows you the provinces in Japan, for example. So you can see some of the variation on this particular date within Japan. And you can see some of the data that we draw from the publicly information that is available. So in Japan, in this particular province, the chance of meeting an infected person is fairly low, 1 in 60,200 active cases. As you can see, you can view this yourself. If you have a look at the website that's shown, you can browse through this map and the supporting table below it. And I can just say, you know, I've seen these maps before. They're a dime a dozen these days. But closer examination will show you some significant value adds. Descriptive analytics have been used extensively, and there is just a smidgen of predictive analytics thrown in. If you have a look at the trend predictors, for example. It is a work in progress. The real use of the data is actually less visible. So what you see here is really the top of the iceberg. For example, when we ingest a travel itinerary, every location is automatically checked for current and emerging risk. It's not always about COVID. It could be about storms, floods, bushfires, earthquakes, volcanoes, or even civil unrest. Our database is used to access a range of different data sources and assess a total itinerary and then alert the traveller along the way. And if the traveller has an active geolocation process in place, we will actually monitor the current location for the individual against any likely risk that the traveller may be facing on their journey. I mentioned that it's not always easy. It's really data 101, but it is important. When we assess risk, we address the following questions. How does the data affect the traveller's health risk status? And will this location, this flight, this accommodation, this venue be a risk to the traveller? To that, understanding data is the key. Now, we made an amazing discovery, guys. We realized that COVID does not infect people between 55 and 72 degrees latitude on weekends. And we know that because we had a look at the data. Data tells us that on this long weekend, from the 31st of October to the 2nd of November, there were no new cases in Sweden. Medical science has not been able to explain this particular phenomenon, but if you want to have a relaxing weekend out, then go to Sweden on the weekend. Okay. There is a big problem with some of the data and actually interpreting the data that flows. Getting it wrong can have severe consequences. There are many techniques, which most of you will know about, to overcome some of these. But generally, our main approach is to go and do comparison between this data, trends, and other data and trends, and try to iron out the deficiencies in data as it flows in, noting that the data comes through 24/7, 7 days a week, but some of it is not particularly helpful, like weekends in Sweden. We need to make sense of the messy data, and I'm not going to tell you as data professionals how to do all of that. There are many, many, many different techniques. As long as we realize why we're doing it. We're doing it to actually identify whether a person traveling is likely to be exposed to risk. I promised you a little bit more about testing. You'll hear a lot about rapid tests, coughing into COVID detectors, spitting into cups. We've all seen the pictures of that very uncomfortable COVID test where they push a stick up your nose. All very messy stuff. But here's a little bit of science around the testing. And it's important because what we need to identify is how effective particular measures are. There are 2 types of tests administered, and they have to be administered at the right time, in the right location, and by professionals to get the best results. So, for example, conducting an antibody test within the first 6 days after an infection is a futile activity. The accuracy is only about 40%. So if somebody is not infected with COVID, but happens to be hanging around at an airport for a few hours and touches something and is subsequently infected, COVID tests at the airport are not going to detect anything. The same thing will happen is as the person lands, an antibody test within the first 6 days, so if it's a one-day trip, are not going to detect anything. It's a relatively futile activity in those circumstances. They will, however, pick up if the person had been infected more than 6 or 7 days before. Conducting a nucleic acid or PCR test from 14 days after an infection is similarly flawed. The right combination of tests can more than double the accuracy and the reliability of the tests. goPassport understands these models and guides the traveller through the best sequence of testing, and it monitors the outcomes of the testing and flags if the sequence is wrong or the testing is inappropriate. Just one thing, just a little bit of trivia around COVID-19. Attack rates. This is the percentage of people that will contract COVID over time after being in contact with an infected carrier. The rule of thumb that we tend to use is that it is 1 to 5. So one person boarding a flight, if the flight is long enough, then at the end of the flight, 5 people would have been attacked by COVID-19 from that one infected person. The science comes from an analysis done in China based on fast train travel. And you can see some of the details that the attack rate for each seat increases by 0.15% for every hour that the person has traveled with an infected person. This is important for us because Australia is a long way from anywhere. And most flights tend to take more than 12 hours to get here. So the longer you're on the plane with an infected person, the higher the rate of being infected. For people sitting in adjacent seats, this increases even further to 1.3% per hour. Passengers sitting within 3 rows or 5 columns, the rate varies between 0 and 10%. So how reliable are the components of our controls? Here are some suggested numbers. They're not the actual numbers we use now. They were the starting points that we worked on from the beginning of the process before we started applying some measures and validated the tests. But they're pretty good guidance to start with. Each of them have different levels of accuracy. Note the last one, immunization, we really don't know yet. So we've said the World Health Organization seems to accept a vaccine that has 50% effectiveness as an effective vaccine. That means those vaccines that just get over that threshold will be 49% not effective. It's also important to go and work out how each component in a journey affects the overall risk rating. Obviously, symptom screening done by yourself will have a very low impact on the rating because it is highly unreliable, whereas testing, of course, can be, if it's done properly, extremely reliable. That's at a journey. You can see here that these are 3 options of flights. So from the left to the right, there's a KLM-based flight, a Finnair-based flight, and the British Airways flight. They all go from London to Sydney, and they all take different routes. You can see that we calculate the risks of ports. We calculate issues such as, is there an overnight stay on the way, and where is that overnight stay? We look at departure and arrival times. We look at aircraft type. So you'll see the Finnair flight, for example, uses a small Embraer 190 aircraft, which is a narrow body aircraft with 3 seats in a row. Not much opportunity to get out of the way of other travelers in one of those flights. You can imagine that all of those factors lead in. So the flight duration is, for the first flight, the British Airways one, you're traveling for 36 hours. The Finnair flight, you're traveling for 54 hours. And the British Airways flight on the right-hand side, is 22 hours. And the British Airways flight is a direct flight with a short stopover in Singapore, where there is a low airport risk rating. All of this data has to be made to work. And this is how it's communicated. The traveler is sitting in the middle, and basically the traveler, as they move through, provides data and is measured for risk all the way along that path. Information is provided to the right place at the right time and in the right form. goPassport gets information to the traveler using omni-channels, so SMSs, in-app messaging, etc. Government agencies are able to access critical data. So, for example, the border authorities need to know just whether a person is clear or not clear. Airlines need to know the same thing. All of this requires a high level of automated real-time messaging based on a constant analysis of the traveler's intended and actual location and the traveler's relationship to risk location. Here's the really exciting thing, and I've left it for the last minute or so. Once we have fully deployed, we will start collecting data about test results, routes taken, locations, and we will be able to refine our risk data models. We'll increase the accuracy, and we will increase our ability to look forward and predict. We will be able to see more accurately problematic locations, flights, accommodation providers, and other risk vectors by tracing back occurrences of infection during travel. This is an extremely powerful capability, and it really motivates us to keep moving forward. Just to finish off, we follow the Australian privacy principles. We are GDPR compliant by design. Importantly, data is encrypted end to end. and travelers at the end of the journey can ask to have their data completely wiped from all our systems. We retain the non-personal information for research purposes, but personal information is deleted from all components of our system, including backups and standby systems. Thank you very much for your attention.